Today's presentation is going to be on blood circulation. The blood is collected in the heart from superior vena cava, inferior vena cava, and from the coronary sinus. Now, superior vena cava, inferior vena cava, and the opening of the coronary sinus all into this chamber right here. This is the right atrium. From the right atrium, the blood is passed through the tricuspid valve, which is attached to the chordae tendineae, on the papillary muscles right here, on the papillary muscle into the right ventricle. From the right ventricle, the blood is pushed through the Semilunar valve into the pulmonary trunk. From the pulmonary trunk, it divides into the left pulmonary artery and the right pulmonary artery. So the pulmonary trunk divides into left and right pulmonary artery, which then lead into the lungs, get purified, comes back through the pulmonary veins. You have the right superior pulmonary vein, right inferior pulmonary vein, left superior pulmonary vein, and left inferior pulmonary vein. The blood is collected into this chamber right here. This is the left atrium. From the left atrium, the blood passes through the bicuspid or mitral valve, which is also attached to the chordae tendineae on top of the papillary muscles, into the left ventricle. From the left ventricle, the blood passes through the Semilunar valve into the ascending aorta, then the arch of aorta, and the descending aorta. The first two branches of the ascending aorta are the right and left coronary artery. For the arch of aorta, you have the brachiocephalic trunk, left common carotid artery, and left subclavian artery. You also remember them as A, B, C's. A is for arch of aorta, B is for brachiocephalic trunk, C is for left common carotid artery, and S is for the left subclavian artery. The brachiocephalic artery divides into right common carotid artery and right subclavian artery. The right coronary artery divides into two branches. The right coronary artery goes, and one of the branches, this one, which is known as the marginal branch, and it curls around in the back, which is the posterior interventricular branch. It's also known as posterior interventricular descending branch. The left coronary artery is just a little bit, and it divides right over here. It divides into anterior interventricular branch, or also known as anterior descending interventricular branch. The other branch of the left coronary artery, is the circumflex branch. The blood is collected from the interior of the heart through the great cardiac vein, from the posterior of the heart to the middle cardiac vein. The great cardiac vein and the middle cardiac vein combine to form the coronary sinus, which then opens up into the right atrium as the opening of the coronary sinus. Also, a little bit of the anatomy of the heart. This is the apex of the heart, and this is the base of the heart. In the book, it's referred to as, in the back part, you can see the base easily. Now, anteriorly, you also see that between the atria and the ventricles, there's a groove right here. If I remove all these vessels, there will be a groove. This is known as coronary sulcus. A sulcus is just a groove where, in this case, coronary arteries are present. Also, you see these ear-shaped lobes on top of the atria. These are known as auricles, just like ears. So these are the auricles. Now, these auricles are on the left atrium, so these will be left auricles. On the right atrium, they're not that visible, but you can still see the impressions. These are the right auricles. Also, there's another sulcus where these vessels are present. The great cardiac vein and the anterior interventricular branch of the left coronary artery It's also known as anterior interventricular sulcus. Similarly, posterior interventricular sulcus. This white ligament right here, it's attaching the two arteries. Even though they're different color, but the definition of an artery is which is taking blood away from the heart. So both of these vessels are taking blood away from the heart. The vessel is taking towards the system, towards the rest of the body. And this artery is taking towards the lungs to be purified. Now this white ligament, this is known as ligamentum arteriosum. Very easy to remember. Between the two arteries, a ligament. Now, inside the right atrium, you can also see that there's a white spot right here. Right underneath, right posterior or superior to the coronary, opening of the coronary sinus, this white spot, or this oval spot basically, is the foramen ovale. Well, it used to be foramen ovale, now it's called fossa ovalis. Foramen ovale in the fetal heart, or in the premature fetal heart, the blood will bypass the blood from here. Similarly, ligamentum arteriosum was also ligamentum arteriosus, which will bypass the blood. We need to cut that part. In between the two ventricles, this part right here, this is the interventricular septum, which divides the two ventricles. If you look at the left ventricle have a very thick walls because it's pumping blood to the rest of the body. Whereas the right ventricle has not that strong or thicker muscular wall because it's only pumping blood towards the lungs to be purified. Now some of these branches which you see on the superior vena cava, you can see the two brachiocephalics. This is the left brachiocephalic vein, and you have the right brachiocephalic vein. Also, in the back of the superior vena cava, you also see this attachment or this cutoff. This is of the azygous vein. Okay, thank you very much.